Assessment and testing is the core practice that is being performed by registered psychometricians in pursuant to measure psychological constructs, provide diagnosis, and treatment plan to the client. Therefore, it is crucial for the assessment and testing to be as accurate, valid, and reliable as possible through considering several factors that may affect the results gathered from the client. Along with the technological advancement and progression, the practice of psychological assessment has developed in new areas of practice. Thus, the assessment procedures, professional competencies, and ethical guidelines consideration in psychological testing and assessment should be more focused when conducting assessment and testing, wherein written in the APA guidelines for psychological assessment and evaluation.
Later in this video, 5 case vignettes will be presented that will discuss the application of APA ethical guidelines in different scenarios wherein psychological assessment and testing is anticipated to be conducted in the clients. APA guidelines aim to assist and inform psychometricians and psychologists in its best practice when conducting psychological assessment, testing, and evaluation. And now, we have pioneered psychologists here, and they are Mr. A, Miss C, Miss U, and Mr. B, who will guide newly registered psychologists in applying APA ethical guidelines in psychological testing and assessments.
Good day, Mr. A. Sorry for interrupting you, but I have this case wherein I am tasked to conduct a psychological assessment on a couple to ascertain their psychological incapacity for an annulment case. I already contacted the estranged husband, but he seems to be doubtful of the process and respond arrogantly. And there is a serious animosity between the couple, because during the process, he would usually say he cannot remember most of the personal experience asked. In order for me to proceed to the assessment test, what should I do, Mr. A?
Thanks for your approach, Audrey. In that case, informed consent must be first presented to provide a legal requirement under which both parties are rendered to have agreed if they clearly comprehend the general purpose, possible outcomes, and relevant evidence of psychological assessment procedures. For the second process, you will be going to conduct an interview with the husband and wife to have background information about their marriage. But remember, establishing rapport to promote an atmosphere for wherein the client will feel safe and to ensure a secure confidentiality is also important, so the husband will find comfort in answering questions from the interview. It is also mentioned earlier that the husband is very doubtful and uncooperative for the psychological assessment. Therefore, you must conduct a mental status exam in order to determine if the client, especially the husband, can assess an organized evaluation of the patient's cognitive and behavioral functioning that can be obtained through mental status exam. Lastly, according to APA Guideline 7, you may also provide third-party report measures. This will help to provide more information about the clients, where you get multiple sources of the clients from the people he is close with, such as their friends and family. It is also considered important in the evaluation process.
Good day, Mr. A. May I have your time because I need some help?
Oh, hello Camille.
I am assigned to make an assessment for nullity of marriage, but the respondent could not be found, and according to his former wife, she had been unaware of his whereabouts for years already. Although details of his last known address were available, no contact details were provided. How can I make a valid and reliable assessment over a person I cannot locate for the assessment procedure?
In that given situation, to make a valid and reliable assessment to a person you cannot locate for the assessment, you may proceed to use case, personal history, and portfolio of this unlocated person, or let's say any of the multiple sources of relevant and reliable clinical information that may use in the methods of your assessment. Third-party measures, including parents, extended family, colleagues, friends, and peers, may also use as sources of information. And as a competent and well-equipped psychometrician just like us, it is your duty to integrate the information coming from the multiple sources into significant information. Moreover, conducting assessment in multiple settings from the client or assessee is important to address situation-specific behavior and variable functioning based on the situation. Good day, Missy. I need your help right now. I am about to conduct an assessment of a client who is also a Filipino psychologist. She is a strange wife of the petitioner German husband, and she has extensive experience in the field, and she began to question my procedure. Particularly, she is pointing out the limits of the projective test I am using. What will I do in order to proceed this assessment task?
Since the Filipino psychologist is familiar with how assessments are conducted, she appears to be having what we call the Hawthorne effect, as she tries to question the procedure knowing that she is being evaluated. For instance, APA Guideline 6, the standardization, reliability, and validity are a few examples of psychometric qualities of tests and other instruments, and these psychometric aspects serve as the foundation for interpretation and are essential for making decisions which might be affected in the given situation. This can help us choose the most appropriate test or tool to utilize. Therefore, the alternate forms of reliability shall be conducted in order to reduce the Hawthorne effect. The outcomes of two different iterations of the same test, form, or questionnaire should be comparable, and we will use another projective test that the client is unfamiliar with. Finally, we will employ retest reliability, which ensures that the outcomes of a single session with a Filipino psychologist are accurate and consistent across time.
Good day, Miss Yu. I have this client that seeks psychological assessment and he also wanted to undergo the procedure of intent of filing for nullity of marriage. But he is illiterate, which means he cannot read and write. What will I do in order to conduct a psychological assessment?
Okay, so since you stated that the client is illiterate and after you reviewed the cases of the client, you need to provide an informed consent based on the preferred language of the client. In addition, EPE Guideline 10 states that the validity and reliability of psychological test results are significantly influenced by demographic and individual factors, including the client's dominant language. According to research in a wide range of fields of expertise and competence, in order to continue the assessment, the client should have the presence of an impartial witness, most likely his relatives, and they also need to sign the informed consent. And after performing those steps, you are now eligible to proceed with the assessment. Good day, Mr. B. Sorry for interrupting you, but I would like to ask what will I do in order to proceed with my assessment? After I have learned that my client and his wife is both deaf and mute. Although they have an interpreter, I barely know what is the guideline are for PWD, specifically deaf and mute, who have an interpreter. They are still also not suited for the examination that I have prepared.
As the case stated that both of the clients are deaf and mute, although there is an interpreter present, we do not know if the interpreter understands the principle of psychological assessment. And according to the APA, clients with communication disabilities may use specific methods or technologies to engage in psychological services. Clients with speech disability may communicate with alternative or augmentative communications such as speech words, speech synthesizers, or computers. Clients who are deaf or hard of hearing and have a speech disability may call or be called via the telephone or use internet and video relay services. Additionally, psychologists have an obligation to provide effective auxiliary aids and services to deaf and hard of hearing clients. Also, clinicians should seek to use the services of interpreters who are certified by the organizations. Psychology seeks to promote accuracy, honesty, and truthfulness in the science, teaching, and practice of psychology. In these activities, psychologists do not steal, cheat, or engage in fraud, subterfuge, or intentional misinterpretations of facts. Psychologists strive to keep their promises and to avoid unwise or unclear commitments. In situations in which deception may be ethically justifiable to maximize benefits and minimize harm, psychologists have a serious obligation to consider the need for possible consequences and the responsibility to correct any resulting mistrust or other harmful effects that arise from the use of such techniques.
Confidentiality is a respected part of psychologists' code of ethics. Psychologists understand that for people to feel comfortable talking about private and revealing information, they need a safe place to talk about anything they like without fear of that information leaving the room. Confidentiality plays an important role in the psychology field. The confidential bond between these mental health professionals and their clients represent an important professional obligation and create a secure relationship foundation within the helping profession. The concept of confidentiality emphasizes that everyone has a right to privacy. Psychologists respect the dignity and worth of all people and the rights of individual to privacy, confidentiality, and self-determination. Psychologists are aware that special safeguard may be necessary to protect the rights and welfare of person or communities whose vulnerabilities impair autonomous decision making. Psychologists are aware and respect cultural, individual, and role differences, including those based on age, gender identity, race, ethnicity, culture, national origin, religion, sexual orientation, disability, language, and socio-economic status, and consider these factors when working with members of such groups. Psychologists try to eliminate the effect on their work of biases based on those factors, and they do not knowingly participate in or condone activities of others based upon such prejudices.
In evaluating appropriateness of psychological tests to be administered in the patient, the first thing to consider is its sound psychometric properties, or the psychometric adequacy. Therefore, the assessment to be administered shall demonstrate sufficient validity for their uses and has sufficient score reliability, making sure that the psychological test is appropriate for the purpose. It measures what it intends to measure and has consistent score for its relevance. Second, the psychological assessment shall demonstrate good item, which can help discriminate the test takers. Items are not susceptible for guessing, and cues for rejecting another item are undetectable. Third, tests should be up to date, which are appropriate for population setting and context at hand. Fourth, psychological assessment should be culturally competent, which omits forms of biases in cultural attitudes that may lead to potential misuse of data. Lastly, the psychologist, psychometrician itself, should strive for competence, mastery, and skillful evaluation in conducting psychological testing and assessment.
Because the publisher's administration script, which contains instructions, scoring, and test protocols have been subjected from thorough reviews, test tryout, analysis, and revision in order to obtain validity and reliability in reference to the referral question or the purpose to which the results are applied. Therefore, changing the script of the publication script will affect the content validity and the way it should be constructed when it is well calibrated and designed to measure what it needs to be measured. When the test is outdated, it means that the test no longer measures the appropriate construct that should be measured. Therefore, validity reduces, thus reliability is also reduced because further revisions in the psychological test or questionnaire is being made when new research, ideas, and concepts are discovered in related to the construct or variable that purports to measure. Thus, outdated tests or questionnaires may not be ideal or optimal to measure what it intends to measure.